Well, joining us now is founder and COO of RIP Medical Debt, Craig Antico. And Craig, how many families are facing a financial crisis because of medical debt?
Well, there's over 68 million people that are what we call either underinsured or uninsured. I mean, Texas alone, about 15% of your population has no insurance, and many people there have just so high deductibles that it's equal to either 10% of their income if they're making a good living, or more than 5% of their income if they're making, say, less than 2 times the poverty level.
So 287 people have been chosen in the San Antonio area to have some or all of their debt forgiven with the KENS 5 contribution. How do you go about selecting these people?
These people are selected randomly. It's a random act of kindness that comes from you guys. And what we do is we look to see if they're making a low amount of income. So first is income. So if they're making less than 2 times the federal poverty level, we abolish their debt. If they're making more than that, they still could be in hardship. I mean, if you get into cancer, for example, you might be spending 10, 20, 30% of your income on out-of-pocket expenses. So if the debt itself is equal to 5% of your gross income, you qualify. Or if you've used all your savings, so you're technically bankrupt, you have no assets relative to how much you owe, then you get help from us too. Those are the three reasons or ways that we qualify people.
Now, right now, people cannot apply. And why can they not apply to have their debt forgiven, to be considered?
We have about $5 billion of debt that we can buy, medical debt, at any one time. But there's almost $1 trillion of debt out there. So the chances of us finding your debt, if you were to apply to us, is so low that we just don't want to give that expectation that you're going to get your debt abolished, because it's such a low probability. Once we start to get the hospitals and doctors and all of these investors that buy these accounts into our system, then we'd have a good chance of finding people's debt. Right now, it's just too hard to find a debt that you owe and then be able to negotiate with the creditor or the provider to buy it.
And so if people contribute right now, how much debt can they buy for a $10 donation?
Well, listen, it's 1 to 100. So you just add 2 zeros to your donation. It tells you how much you can abolish with that donation. We get people that give $1 because they know it's going to abolish somebody's $100. Your $10,000 goes and abolishes $1 million. So of course, then $10 is 1,000, and $100 is 10,000, and so forth. So it's such a multiplier effect that anybody really can give and make a big impact.
What advice do you have people with medical debt who may not be getting one of these letters? What can they do to improve their situation?
They first should know right off the bat what poverty level they're at. So if they go to a hospital, all hospitals have financial assistance policies, and they're generally, if you make 2 times the poverty level or lower, you don't have to pay for care because it's too much of a hardship. So you have to know whether you qualify for this and take it. Or Medicaid, one of the best insurance plans that you can have if you're disabled, have a very low income, you should get Medicaid, because I have never met anybody that has medical debt that has Medicaid. So never, just don't feel that it's a stigma or anything like that. And if you can't afford, you got to call your hospital and tell them, I can't afford to pay this, or even the collection company. You should always talk to the collection people, but make sure you don't put it on a credit card, because that's where you're going to have interest and interest and interest. And that amount will double every 6 or 7 years because of the high rate of interest. You don't want to do that.
Okay, so that's good advice for people who right now are facing medical debt. Don't put it on a credit card. Also, contact the collection agency. Can they negotiate with the collection agency?
They can always negotiate. And what you should do, you should take your income, your household income, and take 2% of it. That's all, 2%, maybe 3% if you can do it without a hardship. And that's the only amount you should pay out of pocket for expenses for the year. That means all the collection companies that are calling you have to get paid out of that fund. And don't go over that, because that's the line where people go into hardship. And we don't want people going into hardship. That's what RIP medical debt is all about, is making sure that people are not getting into hardship because of medical debt or paying down the debt. You have to be in charge of your own finances and never pay more than you can afford without going into hardship. And that means, you're not paying your utility bills, you're having less food than you want, you can't fix your car. All of a sudden it will turn into material hardship where you can't pay your mortgage. You can't pay for basic necessities. So we can't allow that to happen. And the only way you can do that is if you don't spend more than 2 to 3% of your whole income on this paying out of debt or out-of-pocket expenses.
Okay, Craig. Well, thank you for joining us, and hopefully we'll get a lot of people to contribute and we'll be able to help more people.
Thank you. We'd love to make the impact there.
Thank you.